The technology in the industry that's also changed is that AI is rolling through the industry as it is throughout healthcare, and we're finding that this is increasing and improving patient healthcare, both in speed of diagnosis and accessibility, because the equipment is able to produce the results quicker. It means that more slots are available for other patients to attend. This decreases waiting time and improves healthcare overall. I'm Mansoor Parker. I'm a diagnostic and interventional radiologist. I'm a founding partner of Quantum Radiology, a group of radiology practices in Western Sydney. I'm a member of the Australian Diagnostic Imaging Association, a board member there. I'm also a committee member for AMSIG, which is a government body for medical imaging, health and safety. I'm a member of the Interventional Radiological Society of Australasia and of the Australian Musculoskeletal Imaging Group. I have advanced training in cardiac imaging and CT colonography. The turning points I've had in my education and career, I grew up in Tasmania and Hobart and did my medical training there. It was an interesting time because at the time I was heading for the cardiothoracic surgical training program, and speaking to a colleague at the time, they said, you're doing really long hours. You're here for early ward rounds and late ward rounds. You're at hospital all day. And she pointed out the window at 5 p.m. and showed me all the radiologists leaving work that day and said, you need to take another look at what career path you want to look at. And it was at that point I thought, well, maybe diagnostic imaging is a good pathway to follow, where you get the benefits of both the diagnostic component, but also the ability to do interventional radiology and that patient interaction. So that was the real reason, or the main reason I went into diagnostic imaging after that conversation. It gave me food for thought. After medical training, I spent 2 clinical years working in the hospital system, but I thought moving to Sydney would provide me a greater scope of expansion of my capabilities and access to different specialists and training programs. I moved to Sydney, and within the first year of moving here, I was fortunate enough to get a radiology accredited training onto the training scheme, and I started my radiology journey. Part of that journey, working with different specialties within the industry, whether it be a respiratory radiologist, a chest radiologist, or an abdominal radiologist, or a musculoskeletal radiologist, I got to see the various parts of the subspecialization, and that tweaked my interest because I noted that in private practice, when patients went there, and I went as a patient, that accessibility was limited. And so I focused during my training to try to get a well-rounded education, if you like, in the sector, where I was skilled at multiple fields in the diagnostic imaging area as well as the interventional, so I could provide those services. Coming out, opening a private practice was quite different to what I thought it would be, to be honest. I was imagining a lifestyle of an 8 to 5 workday, but owning a practice has so many more responsibilities, and I was finding I was working very, very, very long hours, particularly initially. It was a do-or-die situation financially. In order to make a practice successful, the cost of getting imaging equipment is significant, and staff, and we had to make sure that our staff was looked after first and foremost. There's been a lot of projects that we're doing lately. We're on a big expansion phase at the moment, growing our practice group and also replacing all our equipment within our group. But the thing that I found most rewarding is introducing a partnership model within our group, where we're onboarding our partners, our associate radiologists that have been with us for many years, and getting them to think through a different viewpoint, a different lens as a practice owner, as a partner, and basically increasing our quality of our business overall, because we have people that are heavily invested in the success of the business. Trends in radiology at the moment are both in technology and also accessibility. The government has recently released a expansion of the MRI eligibility, where more and more MRIs are going to be available for the Australian community, where the provider numbers are no longer going to be restricted. Currently, partial MRI licenses have gone to full as of 1st of July 2025, and 1st of July 2027, all MRIs will be eligible for provider numbers. That means that patients can go to any practice with an MRI and be able to receive a Medicare eligible scan. The technology in the industry that's also changed is that AI is rolling through the industry as it is throughout healthcare, and we're finding that this is increasing and improving patient healthcare, both in speed of diagnosis and accessibility, because the equipment is able to produce the results quicker. It means that more slots are available for other patients to attend. This decreases waiting time and improves healthcare overall. The trends, particularly in Western Sydney, in terms of healthcare, is people are becoming more aware of their health. The accessibility through the internet, of finding out what could be happening, what disease I may have, I may not have, has made people more aware. In the past, in Western Sydney, people were particularly reluctant to see their doctor or get treatment. In fact, many health complaints were ignored until the problem became too large or significant and treatment became difficult. So we're finding people are more aware. They are, within their communities, also noting that new technology is available, word of mouth of accessibility to equipment. But I think also generally the understanding of the cultural needs of patients, both in terms of their work, being able to offer appointments earlier in the morning before work and after work, but also in terms of those cultural sensitivities of whether it be offering a bilingual service or offering sort of privacy that some in the population may require. I did a 6-year medical course at the University of Tasmania, and 2 years of, actually it was nearly 3 years of clinical training of just working as a doctor to get experience. After that, I did a 5-year training in radiology. That's changed now to 6 years. Once you've done those 6 years, I was about 32, I think, when I got my specialty. I had to start working within the radiology sector to gain more experience, because once you're qualified as a specialist, everyone thinks you should be fully equipped to handle all things, but I think it's just the beginning of the journey. The learning continues. So I'm still learning, and I think I'll continue learning for many more years to come. Advice for if you want to enter the field, I think it's an amazing field. It's expanding. The need for radiology is ever growing. I think when I was a youngster, I would hardly know anyone that's had an ultrasound or a CT or an MRI, but it seems every second person now has had some sort of imaging, which is great because we're getting earlier diagnosis and earlier treatment. Coming into radiology, the advantages, you have work flexibility. You're able to work from home if you need to. It's great to work in the practice because then you have that sort of collegiate environment and able to do interventional procedures as well. Unlike other clinical fields where you are bound by an office where a patient has to come in and physically see you, radiology provides that advantage where you can be off-site, you can be in different location. Another thing that honestly attracted me to radiology was that in other clinical fields, there was a significant weighting to the social aspects of medicine that could be difficult. Whereas with radiology, you can get straight to the actual treatment or diagnosis component. And as a radiologist, I'm fortunate my colleagues in the general practice world and other specialties have to manage the other parts. I love helping people. Fundamentally, I like being able to work with others to get to a result that has a positive impact on patients, on people. So for me as a practice owner, that extends beyond just the patient. Actually, it's with my staff, helping them educate them, helping them advance their career, supporting them. Sometimes I feel like a father figure with our staff, where you have to provide that support and guidance, and you have to try to foster and their career so that they keep growing, and the staff tend to appreciate that. In fact, one of the things that our staff constantly say is they appreciate the education, the guidance, support, and I think that's why we have such significant loyalty within our group. I am a bit of a race car driver. I'm a bit of a car collector, so I love getting to the racetrack and getting some frustrations out and doing some fast lap times when I can. It's not always fast, unfortunately. I'm also an ex-volleyball player, both indoor and beach, and I am accredited state-level coach for indoor volleyball. Both my sons represent New South Wales for volleyball as well, so I enjoy coaching and watching them. My son recently played in the Under-21 National Championships and it was fun watching him. My son currently is playing in the Under-18s National Championships in Perth, but I've been banned from watching him because I give him too much pressure. So I have to watch from the distance. I have to watch streaming videos of him. But yeah, volleyball, indoor and beach, love it.